Good evening, everyone. We're going to report cerebrospinal fluid. And before I begin, I'm going to present myself. I'm Resvant Kinday Torma, uh, Bisamelas 3B. And to begin, next, please. So cerebrospinal fluid, or CSF, major fluid of the body, provides a psychologic system to supply nutrients to the nervous tissue, remove metabolic waste, and produce a mechanical barrier to cushion the brain and spinal cord against trauma. Formation and physiology. The brain and spinal cord are lined by the meninges, consists of three layers: the dura mater, or the Latin word for hard matter, the arachnoid, spider web-like, and the pia mater, Latin for gentle matter. CSF is produced in the choroid plexus of the two lumbar ventricles and the third and fourth ventricles. In adults, approximately 20 millimeters of fluid is produced every hour. The fluid flows through the subarachnoid space located between the arachnoid and pia mater. Next. So to have an insight for the location of uh, CSF, it is in the arachnoid, in the meninges, which is the arachnoid mater and pia mater. So next, the choroid plexus are capillary networks that from the CSF from plasma by mechanisms of selective filtration under hydrostatic pressure and active transport secretion. Capillary walls through the body are lined with endothelial cells that are loosely connected to allow passage of soluble nutrients and waste between the plasma and tissue. In the choroid plexus, the endothelial cells have very tight fitting junctures that prevent the passage of many molecules. This tight fitting structure of the endothelial cells in the choroid plexus is termed the blood-brain barrier. Blood-brain barrier protect the brain from chemicals and other substances that are harmful in the brain. It also prevent the passage of helpful substances, including antibodies and medications. So in order to have an insight is like more like uh, protection in our body in our brain. So in specimen, so if you're going to ask what's the purpose of collecting CSF, it is for analysis. If can be, it is used to diagnose if there's certain neurologic disorders, or in most and in the ano to, uh, mer primary kumaga ano, sige ni, uh, like ano, common rather, sa is meningitis. So specimen collection. CSF is routinely collected by lumbar puncture between the third, fourth, or fifth lumbar vertebrae. It does require certain precautions, and including measurement of intracranial pressure and careful technique to prevent infection or neural tissue damage. The volume of CSF that can be removed is based on the volume available in the patient adult versus neonate, and the opening pressure of the CSF, measured when the needle first enters the subarachnoid space. So actually there's four tubes that we're going to use in collection of CSF, and I'm going to discuss the purpose of each of tubes. So specimens are collected in three sterile tubes. Tube 1 is used for chemical and serologic tests because these tests are least affected by blood or bacteria introduced as result of the TAP procedure or of the TAP. Yeah. Tube 2 is usually designated for the microbiology laboratory. 3 is used for the cell count because it is least likely to contain cells introduced by the spinal tap procedure. So for tube, no, okay na. A fourth tube may be drawn for the microbiology laboratory to better exclude skin contamination or for additional serologic tests. Supernatant fluid that is left over after each section has performed its test may also be used for additional chemical or serologic tests. Excess fluid should not be discarded and should be frozen until there's no further use for it. So as we can see, there's number in it. So, okay na, okay na. Ideally, tests are performed on a stat basis. If this is not possible, specimens are maintained in the following manner. Hematology tubes must be refrigerated. Microbiology tubes remain at room temperature. Chemistry and zoology tubes are on the frozen section. So we're going to discuss the appearance of the CSF when excreted in our body. The initial appearance of the normally crystal clear CSF can provide valuable diagnostic information. Examination of the fluid occurs first at the bedside and is also included in the laboratory report. The major terminology used to describe CSF appearance includes crystal clear, cloudy or turbid, milky, xanthochromic, and hemolyzed or bloody. So in this picture, it represents that the normal appearance is crystal clear, and the next one is xanthochromic, hemolyzed, and cloudy. So xanthochromia is a term used to describe CSF supernatant that is pink, orange, or yellow. A variety of factors can cause xanthochromia, the most common being the presence of RBC degradation products. Depending on the amount of blood and the length of time it has been present, the color will vary from pink, very slight amount of oxyhemoglobin to orange, heavy hemolysis, to yellow, conversion of oxyhemoglobin to unconjugated bilirubin. Other causes of xanthochromia include elevated serum bilirubin, presence of the pigment carotene, markedly increased protein concentrations, and melanoma pigment. Xanthochromia that is caused by bilirubin due to immature liver function is also commonly seen in infants, particularly premature infants. So next,
Ako na rin. So, good day. So I am John David Balante from Section C, and the topic that I will discuss is about the first topic that I will discuss is traumatic collection or TAP. So TAP is grossly bloody CSF can be an indication of intracranial hemorrhage. Three visual examination of the collected specimens can usually determine whether the blood is the result of hemorrhage or traumatic TAP. So traumatic collection or TAP is uh, indication of intracranial hemorrhage and also uh, whether the result of hemorrhage or traumatic tap. So next slide, please. So blood from uneven blood distribution. So from the word itself, uneven. So blood from a severe hemorrhage will be evenly distributed throughout the three CSF specimen tubes. And the second one is clot formation. So from the word itself, clot formation, so the blood is clot because of the presence of fibrinogen. So maybe uh, fluid collected from traumatic tap is uh, clots in the plasma because of the presence of fibrinogen. So the third one is xanthochromic supernatant. So RBC must usually remain in the CSF for approximately 2 hours before noticeable. Next slide, please. So cell count. The cell count that is routinely performed on CSF specimens is the leukocytes. So leukocytes is under the white blood cells. So next slide, please. So calculating CSF cell counts. So the standard Neo-Baver calculation formula used for blood cells counts is also applied to CSF cell counts to determine the number of cells per microliter. Number of cells counted in multiplied by dilution number of cells counted multiplied by the volume of one square. So equals cells uh, microliter. So methodology. Normal methodology. Normal adult CSF contain 0 to 5 WBC microliter. The number is higher in children and as many as 30 mononuclear cells microliter can be considered normal in newborns. So they are different between adult and newborns. And total cell counts, clear specimens may be counted undulated provided no overlapping of cells is seen during the microscopic examination. So if you will count a total cell count, is it's forbidden that the cells will overlapping under the microscopic examination. So WBC count, lysis of RBC must be obtained before performing the WBC count on either diluted or undiluted specimen. So quality control of CSF and underbody fluid cell counts, liquid commercial controls of spinal fluid RBC and WBC counts are available from several manufacturers. So next slide, please. So differential count on CSF specimen. So this is the example of differential count on a CSF specimen. So next slide, please. So cell identification in CSF. So the first one is valuable diagnostic aid, and the second one is differential count is crucial for accurate diagnosis. So why it is differential? Because sometimes you will they are the lot of the same cells that kanang hindi mo siyang ma-recognize as same cells like RBC or just like that. And stain smear, perform differential count on stain smear. Avoid counting the chamber for better visualization. So you need to avoid chamber for better visualization. And the third one is visualization challenges. The practice of reporting percent of mononuclear and polynuclear cells. Risk missing diagnostically important abnormal cells. So next slide, please. So cell availability maximization. Concentrate the specimen before smear preparation. Ensure maximum cells are available for examination. Why you need to ensure the maximum cells are available for examination? So because you will have a reliable rea- reliable reliable result and have yeah, that's why you need to have a maximum cells are available for examinations. So that's why it is important. So specimen concentration methods, sedimentation, filtration, centrifugation, and cytocentrifugation. So, routine use of centrifugation is in most labs. So, centrifugation. So, so centrifugation procedure. So you need to centrifuge your specimen up to 5 to 10 minutes to save supernatant for additional tests. So it slides from suspended sediment, air dry, stained with right stain. So differential count guidelines. So count 100 cells, classify report in percentage. If cells count is low, report the number of observed cell types. Next slide, please. So, cytocentrifugation. So, this is the part of cytocentrifugation. You can see stainless steel cytoclips here, and cytoslides, microscope slides, cytotunnel, posable sample chamber with attached filter card. So, completed assembly here in the right side, and under those part of the cytocentrifugation is in load position and operation. Next slide, please. So neutrophils. Uh, neutrophils present in the early stages, 1 to 2 days of viral, fungal, tubercular, and parasitic meningitis. So prominently observed in bacterial meningitis. So characteristics may exhibit cytoplasmic vacuoles posed in cytocentrifugation, rapid loss, rapid loss of granules in cerebrospinal fluid or CSF. And the third characteristics is neutrophils in bacterial meningitis might contain phagocytized bacteria. Next slide, please. So this is the picture of neutrophils with cytoplasmic vacuoles resulting from cytocentrifugation. And this is the in the right side, neutrophils with intracellular bacteria. I don't think so if you can see the bacteria, but others is a small dot inside the cells. But I don't think so if you can see that. So next slide, please. That's the bacteria inside the neutrophil. So next slide. So lymphocytes and monocytes seen in viral, tubercular, and fungal meningitis. Reactive lymphocytes with dark blue cytoplasm in viral infection. Increased lymphocytes in asymptomatic HIV, AIDS, moderately elevated WBC, uh, 50 to 50 liter may indicate neurologic disorders. So this is the picture of broad spectrum of lymphocytes and monocytes in viral meningitis. So this is the picture of them, like they like a mono lymphocytes here, and like in the middle one is like a monocytes because yeah, but we are specific in lymphocytes that affected of viral meningitis. So that's how they look like. So next slide, please. Eosinophils increased number in parasitic or fungal infections associated with the introduction of foreign material into the CNS. So macrophages appear 2 to 4 hours after RBC enters CSF, more cytoplasm than monocytes. Phagocytized RBC lead to dark blue black iron containing hemosideroid granules. Further degradation results in yellow hematodine crystals, iron-free hemoglobin, unconjugated bilirubin. So this is the features of kidney pills. Notice centrifuge distortion. And the right side is macrophage containing hemosiderin and hemotidine crystals. So the next slide is from my groupmates.
Uh, Good. So, good day, guys. My name is Joshua F. Makilan from BSMLS 3A. So, non-pathologically significant cells, common after diagnostic procedures or neurosurgery, often appear in clusters, distinguishable from malignant cells by uniform appearance, and, and spindle-shaped cells from the arachnoid lining seen in clusters are associated with systemic malignancies. That's like um, the picture that shows the one from the left is a choroidal cells. It showing distinct cell borders and nuclear uniformity. The one from the right is a epidermal cell. Uh, Notice the nucleoli and less distinct cell borders. Like malignant cells of hematologic origin. Lymphoblasts, myoblasts, myeloblasts, and monoblasts are frequently observed. Nucleoli are more prominent than in blood smears. Resemble large and small lymphocytes appear in clusters based on lymphoma classification, and nuclei may be cleaved and prominent nucleoli are present. The picture from the left is a lymphoma cells with nucleoli, and the one from the right is a cleaved and non-cleaved lymphoma cells. Malignant cells of non-hematologic origin. Metastatic carcinoma cells from lung, breast, renal, and gastrointestinal malignancies in CSF. Primary CNS tumor cells include astrocytomas, retinoblastomas, and medulloblastomas, and fuse cells walls, nuclear irregularities, hyperchromatic nucleoli in malignant cell clusters. This is a picture of medulloblastoma. Notice cellular clustering, nuclear irregularities, and rosette formation. Predominant cells seen in CSF. Type, type of cells, lymphocytes, neutrophils, monocytes, macrophages, blast-form lymphoma cells, plasma cells, epidermal, choroidal, and spindle-shaped cells, and malignant cells. The major clinical significance of um, lymphocyte is normal, and its microscopic findings is all stages of development may be found. In neutrophils, the major clinical significance is the bacterial meningitis, early case of viral tubercular and fungal meningitis, cerebral hemorrhage. Like the microscopic finding of neutrophil is granules may be less prominent than in blood cells which disintegrate rapidly. Major clinical significance of monocyte is normal viral tubercular and fungal meningitis. This multiple sclerosis in its microscopic finding is found mixed with lymphocytes. A major clinical significance of macrophages. RBC in spinal fluid. Microscopic findings may contain phagocyte phagocyte RBC appearing as empty vacuoles or ghost cells, hemosiderin granules, and hematoidin crystals. Thus, for major clinical significance, acute leukemia, microscopic findings, lymphomablast, myoblast, or monoblast. Lymphoma cells, major clinical significance. Disseminated lymphomas resemble lymphocytes with left nuclei. Plasma cells, major clinical significance. Multiple sclerosis, lymphocyte reaction, and its microscopic findings. Traditional and classic forms seen reactive lymphs. Epidermal, choroidal, and spinal shapes cell major clinical significance is diagnostic procedure. Microscopic findings seen in cluster with distinct nuclei and cell walls. Malignant cells. Metastatic carcinomas, primary central nervous system carcinoma, and its microscopic findings is seen in clusters with fusing of cell borders and nuclei. Next, please. Next, please.
So next will be the chemistry test. So madungog ko.
It's good.
Yes. So good evening, guys. So before anything else, my name is Jaron Kirby Magnaye, and I will be presenting chemistry test. So chemistry test is, first of all, what is chemistry test? Now, chemistry test, in the cerebrospinal fluid analysis, it evaluates the clear or colorless fluid that surrounds the brain and spinal cord. So this test is performed by obtaining a sample of cerebrospinal fluid through a lumbar puncture. So lumbar puncture, dito yan banda sa ating likuran. So protein determination, most frequently performed chemical test on cerebrospinal fluid. So 15 to 45 milligrams per deciliter is the total cerebrospinal fluid protein. So there are different tests under cerebrospinal fluid. We have number 1, the cerebrospinal protein, Next is the CSF glucose. The third is CSF lactate. Then last but not least is the CSF glutamine or glutamine. Next is first one is the cerebrospinal protein. So it is the most frequently performed chemical test on cerebrospinal fluid. Normal CSF contains very small amount of protein. So reference value for total CSF protein is starts from 15 to 45 milligrams per deciliter. Take note that the unit for cerebrospinal fluid protein is milligrams per deciliter, while for plasma protein is grams per deciliter. So if protein yung kinukuha nyo, bear in mind that milligrams per deciliter is the unit that we should be using. While for plasma protein, we should be using grams per deciliter. Now, abnormal low value of CSF protein may indicates fluid leaking, or it is due to fluid leaking. In elevated CSF protein, it indicates damage in blood-brain barrier. Now, for the CSF glucose, it enters the CSF by selective transport across the blood-brain barrier. The reference value for CSF glucose is 60 to 70% of the plasma glucose. Now, if there are elevated CSF glucose values, it means that it is due to plasma elevations also. Now, when you have a low CSF glucose value, it means that it can be diagnostic value in determining the causative agent of meningitis. Now, in the CSF lactate, it can be valuable in diagnosing and managing meningitis cases. So levels are greater than 35 milligrams per deciliter, bacterial meningitis, and then lower than 25 milligrams per deciliter, viral meningitis. Now, tissue destruction within the CNS owing to oxygen deprivation, or what we call the hypoxia, increase CSF lactic acid levels. Now, cerebrospinal fluid lactate levels are frequently used to monitor severe head injuries. So if you have, some kind of severe head injuries, what we use is the CSF lactate levels is the one that we are going to be testing in order for us to monitor the severeness of your head injuries. Now, CSF glutamine, it produced from ammonia and alpha ketoglutarate by the brain cells, and normal concentrations of glutamine starts from 8 to 18 milligrams per deciliter. This process serves to remove toxic metabolic waste products such as ammonia in the CNS. Frequently requested for patients with coma of unknown origin. Now, if we have an elevated levels of cerebrospinal fluid glutamine or glutamine associated with to liver disease. Now, more than 35 milligrams per deciliter almost always cause disturbance in consciousness. Now, approximately 75% of children with Rye syndrome have elevated glutamine levels. So for the next one, the microbiology test. Microbiology test, the role of this one in our microbiology laboratory is analyzing the CSF to identify the causative agent in meningitis. Now, for positive identification, the microorganism must be recovered from the fluid by growing it on. Wait, okay. So, by growing it on the appropriate culture medium. So there is a specific culture medium in order for us to grow microorganism for this type of test. So 24 hours in cases of bacterial meningitis to 6 weeks for tubercular meningitis. Now, what are the methods under microbiology testing? We have the gram stain, we have the acid-fast stain, we have the India ink preparation, and the latex agglutination test. All of them will be further discussed. So the first one is the gram stain. This one is routinely performed on cerebrospinal fluid from all suspected cases of meningitis. Although its values lies in detecting bacterial and fungal organisms, A cerebrospinal fluid gram stain is one of the most difficult slides to interpret. The next one is acid-fast stain. This type of staining method is not routinely performed on specimens unless tubercular meningitis is suspected. So take note that this one is only used when there are a tubercular meningitis that is suspected in the specimen. Next one is what we call the India ink preparation. This one is performed to detect the presence of thickly encapsulated Cryptococcus neoformans. So cryptococcal meningitis is now commonly encountered in the clinical laboratory. Now, next is the latex agglutination test. It detects the presence of C. neoformans or cryptococcal neoformans antigen in serum and CSF that provides a more sensitive method than the India ink preparation. Rheumatoid factor is the most common cause of false positive reactions. Now, what on the left side is the image of what we call the India ink preparation for C. neoformans detection. So this one here is the India ink preparation. On the right side, this is the gram stain for the detection of Cryptococcus neoformans. Now, lateral flow assay, or what we call LAF or LAF, provide a rapid method for detecting Cryptococcus neoformans. So latex agglutination and enzyme-linked immunosorbent assay, or what we call ELISA, these methods provide a rapid means for detecting and identifying microorganisms in the cerebrospinal fluid. Now, bacterial antigen test, or what we call BAT, does not appear to be as sensitive to meningitis or meningitis as it is, as it is to the other organisms. Gram stain are the recommended method for the detection of meningitis. Now, for the last topic, we will be discussing serologic testing. Now, for the serologic testing of the CSF, it is performed to detect the presence of neurosyphilis. Now, before we dig deeper to the topic, we need to know first what is serologic test. Now, just to let you know, there are a lot of types of serologic testing, but to let you know, it is a blood test that look for antibodies in our blood. So in all of those serologic testing, what they have in common is that they are all focused on proteins. Now, these proteins is our antibodies. So basically, saying antibodies are kind of like our proteins that our immune system makes to fight off foreign substances such as viruses, bacteria, and other disease-causing pathogens or agents. Now, with that being said, syphilis, since we will be discussing neurosyphilis, we need to know first what is syphilis. Now, syphilis is a sexually transmitted infection or STI caused by the bacterium Treponema pallidum. So take note that Treponema pallidum is the causative agent for syphilis. Now, if this syphilis is left untreated for several time or for several years, it will then turn into neurosyphilis, which means that yung syphilis nag-develop na sa ating tawag niyan, sa ating cerebrospinal fluid in our uh, in our brain part, since diyan yung neuro natin from the word itself neuro. So parang nag-manifest na siya dito sa ating sa cerebrospinal fluid sa may covering ng ating brain. So take note that the use of penicillin in the early stages of syphilis has greatly reduced the number of neurosyphilis cases. So in simple words, penicillin is kind of a antibiotic of choice for this kind of illness. So consequently, the number of requests for serologic tests for syphilis on CSF is currently low. However, detecting the antibodies associated with syphilis in the CSF still remains a necessary diagnostic procedure. So the first serologic testing that will be discussed is the Venereal Disease Research Laboratories, or what we call the VDRL test. So VDRL test, it aids in the diagnosis, of syphilis. So the procedure recommended by the CDC this is the procedure rather that is recommended by the CDC to diagnose neurosyphilis. It is though it is not as sensitive as the fluorescent treponemal antibody absorption test, or what we call the FTA-ABS or FTA-ABS test. But VDRL test doesn't actually look for the that causes syphilis. Instead, it checks for the antibodies our body makes in response to antigens produced by cells damaged by the bacteria. That's why this VDRL test is still utilized nowadays. Actually, dalawa to sila. The first one is the VDRL, the second one is the RPR. And these two type of tests, they have a kind of like a similarities, but later on we will try to differentiate them in order for us to have a better grasp of this type of testing. So next one is the RPR test. Supposed to be I'll be discussing the FTA ABS first, but in order for us to have a better grasp of the topic, I'll be explaining first what is rapid plasma reagent test, or the RPR test. So this RPR test, it has a similarities on the VDRL test, but this one is not recommended because it is less sensitive than the VDRL test. Same to the VDRL, it uses it is a blood test used to screen you for syphilis. So in simple words, both the RPR and the VDRL test is used for screening test for the detection of syphilis. So it works by detecting the non-specific antibodies that your body produces or our body produces while fighting the infection. Now, the last one, we have the FTA-ABS test, or what we call the fluorescent treponemal antibody absorption. So, same with the VDRL, a blood test that checks for antibodies to Treponema pallidum bacteria which causes syphilis. So, same sa dalawang test kanina, the VDRL and RPR, they are a blood test. But this one, this test is specifically checks for antibodies that is particular to Treponema pallidum bacteria. And this bacteria is the one that causes syphilis. So once the antibodies is detected, immediately the test will become reactive, which means that you will become positive for syphilis. Since yung specific antibodies niya ang kanyang dinedetect in response to Treponema pallidum bacteria. Now, the FDA-ABS test, how it works is that it doesn't necessarily check for the syphilis infection itself. However, it can determine whether you have antibodies to the bacteria that causes it. It's usually done if initial screening tests come back positive for syphilis. The FDA-ABS test can help confirm whether the results of this test are accurate. So if yung RPR and VDRL test is for screening, now this FDA-ABS test is for confirmatory. Meaning, ito na yung final test or final stage ng test to confirm whether or not you are positive or reactive to syphilis illness or disease. Now, if the FDA-ABS is used, care must be taken to prevent contamination with blood because the FDA-ABS test remains positive in the serum if treated cases of syphilis. So that would be all. Thank you so much for listening, and I hope you have you already understood what is cerebrospinal fluid testing. Thank you so much.